Hello, and welcome to my video. My name is Jamaal Jones. I'm a Florida-based attorney, and in today's video, we're going to be talking about Incident to billing. Now, there's a lot of physicians out there who may not or may be aware of Incident to billing, but are not 100% sure on how it works. Well, today, I'm hoping to go over in this video how it works and what you can do to benefit from it and multiply some of the profits that your practice will see. Incident to billing presents one of the last remaining opportunities for physicians to multiply their services and increase their income without having to work harder. Sounds pretty good so far. However, the regulations which govern this practice under both federal Medicare program and various state Medicaid programs can present pitfalls to unwary physicians and their staff who fail to properly understand and apply them. These mistakes can lead to costly government intrusion, overpayment demands, audits, and false claim allegations. Both Medicare Part B and many state Medicaid programs include coverage of services that are rendered incident to a physician's services. Unraveling the requirements will help ensure that non-physician practitioners, or NPPs, as they're commonly referred to as an abbreviation, billing is handled correctly. When those services are properly provided incident to a physician's services, and NPP services may be billed using the physician's provider number, or the NPI, and they're allowed to be reimbursed at 100% of the Medicare and Medicaid physician fee schedules. Otherwise, NPP services must be billed at their Medicare or Medicaid program fee schedule, which is typically at around 85% of the applicable physician's fee schedule. Either way, the NPP must have his or her own active, valid Medicare or Medicaid provider number. Now, there's a few criteria that one must keep in mind if they would like to employ this incident to billing practice into their existing physician practice, so that, like I said previously, you don't run afoul of any government regulations. Now, in order to qualify for incident to services for billing purposes, an NPP services must meet several criteria. These include, number one, the NPP must be licensed or certified to provide professional healthcare services in the state where the physician practice is located. In this case, that would be Florida. Two, generally, the NPP must be a full-time, part-time, or leased employee of the physician or physician group practice, although in limited cases, the NPP may be an independent contractor of the physician or physician group practice. Third, the NPP must provide services as an integral part of and incident to the physician's services. And fourth, the NPP must provide such services under the direct supervision of the physician. The physician at all times must be at the premises. The physician does not need to necessarily be in the room, or quite frankly, they don't even necessarily need to be on the same floor, but they need to be within the facility so that in the event their services are needed, the physician can get there in a timely fashion. The foundation of proper incident to billing is that the incident to services must be an integral part of the physician's services. The physician must, this is very important, the physician must have initially provided healthcare services to the patient whom the NPP is treating incident to the physician's services. This requirement does not mean that there must have been a service rendered by a physician for each visit by a patient. Rather, an ongoing course of treatment initiated by a physician with the physician seeing the patient at the first visit will qualify under the incident to billing guidelines. In other words, a physician must see a patient at the first visit, but would not necessarily have to see the patient for subsequent related visits. However, If the same established patient reported a new chief complaint or problem, the physician would have to see the patient again for the new issue before an NPP saw the patient in order to be able to bill for the NPP services as incident to the physician services. So I hope that that's clear. Physicians and physician group practices often overlook the second point when treating patients for ongoing related visits, which also involve new chief complaints. This is an issue which both Medicare and Medicaid programs focus on when auditing and reviewing claims. As a result, physicians and their group practices should develop policies and procedures for ensuring that they only bill incident to services for those chief complaints and problems for which one of their physicians has seen a patient prior to services being rendered by an NPP. Now let's get back to what I previously touched on, which is the direct physician supervision. And this is perhaps one of the most misunderstood aspects of the incident to billing rule, which is the requirement for direct physician supervision of an NPP, providing incident to services. Many state laws permit advanced registered nurse practitioners, or ARNPs, and physician assistants, PAs, to furnish healthcare services to patients without a physician's on-site presence or direct supervision. Many of these state laws permit general physician supervision. However, incident to services must be furnished under a physician's direct supervision under both Medicare and many states' Medicaid program regulations. Direct supervision means that a physician must be immediately available to provide assistance and direction while an NPP is providing services that the physician plans to bill as incident to. While the physician does not have to be in the same room as the NPP, the physician must be in the same office suite. By far, this is the incident to billing requirement which physicians and their group practices misunderstand and fail to comply with. Unfortunately, they often confuse the direct supervision requirements for incident to billing with their state law supervision requirements. This is particularly true here in Florida, for example, where ARNPs and PAs can practice under the general supervision of a physician. Thus, physicians and their office staff need to understand the difference between general supervision and direct supervision. They also must understand the general supervision requirements for ARNPs and PAs under Florida law, and most likely in many other states as well, will not satisfy the direct supervision requirements for incident to billing under either the Medicare program or perhaps the applicable state Medicaid program. Now let's switch gears for a minute and turn to the state licensing requirement. Another common misunderstanding physicians face when billing incident to services is their misconception that an NPP may be licensed in another state and provide services to their patients in the state in which the physician's practice is located. However, both Medicare and Medicaid program incident to billing regulations require that the NPP be licensed or certified to practice in the applicable state before a physician can bill their services incident to. Failing to ensure that an NPP is properly licensed or certified to practice in the applicable state will result in an improper and potentially false claim for incident to services. Moreover, allowing an NPP to perform services when the NPP is not licensed or certified to practice in the applicable state can result in allegations by the Department of Health that a physician is aiding and abetting the unlicensed practice of medicine or nursing. Physicians and their group practices need to ensure that their NPPs are licensed or certified to practice in the applicable state before they permit them to render services to their patients and bill those services incident to. Now, finally, it's important to note that neither Medicare nor Medicaid incident to billing regulations apply in institutional settings, i.e. hospitals or skilled nursing facilities. Physicians cannot bill Medicare Part B or many state Medicaid programs for services furnished by NPPs in an institutional setting, even if they meet all of the other requirements such as direct supervision. Thus, physicians in their group practices must be very careful not to bill NPP services as incident to when they are rendered in these settings. Finally, in order to prevent billing mistakes and problems with regard to incident to services, physicians and physician group practices should develop specific policies and procedures for billing these practices and services and make them part of their compliance plans. While the incident to billing requirements appear to be simple and easy to comply with, many of the recent overpayment audit, civil false claims act, and even criminal cases instituted by the federal and state health regulatory agencies tasked with overseeing the Medicare and Medicaid programs involve allegations of improper billing for incident to services. I want to take this time to thank you for taking a look at this video. I hope that it was informative. And if you'd like some more information regarding incident to billing or any other services, legal services that is, please contact me at JamaalJonesESQ at gmail.com. You can see that right at the bottom of this video, or you can call me directly at 917-912-8108 so that we can either schedule a phone call, a teleconference, or meet in person to answer any questions that you may have. Thank you very much for taking your time to look at this video. Bye-bye.